How much does eyelid surgery cost? Do I need surgery or can it be done with injection?
Thank you for your question. You submitted a single photo with your eyes looking upward, and you're asking how much does it cost for eyelid surgery, and then you ask, can this be corrected with just an injection? Well, I can certainly share with you my initial impression with this limited photo and what I believe you're trying to draw attention to. I'll give you a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people with the under eye area and the cheek area is something I would do every day in our practice. So I suspect what you are trying to draw attention to with the under eye area is the puffiness that is pushing forward and is actually expressed more when you look up. From that respect, we should at least identify what exactly is the anatomy that's causing this. And what I would say to you is that essentially what you're looking at are fat pockets. These fat pockets are referred to as lower eyelid fat prolapse. This means that fat pockets that are normally around the eyes pushes forward and creates these bulges. It's a very common issue with facial aging. It's also typically seen more in a genetic form. Basically, it tends to run in families. In fact, I've actually operated in the same family in 3 generations. So it's very, very common from that respect. Now, to ask the question about whether to do surgery versus injection, well, I would submit to you the idea that if we're dealing with facial aging as an overall issue, well, chances are you'd be a candidate for both. And what does that mean? Well, yes, if you have under eye puffiness and you wanted to see if you could hide it a little bit better by just with an injection, that is possible. It may not be optimal, but it is possible. And the principle behind using filler to help with the appearance of under eye bags is based on placement of filler in an area called the tear trough and the lower part of the eye socket, and that area we refer to as the V deformity. Placing filler in this area can sometimes soften that transition between the lower eyelid fat prolapse and the area adjacent. Because when you think about it, the puffiness can actually make the hollow look deeper. So reducing the puffiness, which is surgery, versus filling. Now, in many patients, there's actually a combination benefit if they were to do the surgery and do filler at the same time. Not necessarily in the same area, but let me explain further. One of the things that we have to understand with facial aging, people always understand wrinkles, they understand sagging. But something that's really not understood as well as it could be is volume loss, not just from skin and fat, but also bone. And this is very, very important because one of the things that we do in our practice is something called structural volumizing. What that means is we use long-lasting fillers such as Juvederm Ultra Plus or Juvederm Voluma and place it on the bone structure around the cheek area and the under eye area. And by doing that, you actually restore some of the lost volume from the receding of the bone structure. And one can argue that the puffiness under the eyes is further accentuated by this recession of the bone structure and further the widening of the eye socket. Now this is difficult for a lot of people to really grasp, but the solutions revolve around this type of strategy. Now that being said, when I evaluate someone like yourself, I take photos from multiple angles and I place them on the screen and we go over the different angles to show what is a fat pocket, what's prolapse, and options. Just to be complete about the options besides fillers is we do something called lower eyelid transconjunctival blepharoplasty. Now that's a surgical procedure, and what we're doing is I'm approaching the fat pockets from the inside of the eyelid. I find that this has been an extremely effective procedure because essentially the shape of the eye is maintained, and the main issue of the fat pocket being pushed forward or creating puffiness is addressed basically with minimal trauma. Essentially, we're reducing, shaping, and repositioning the fat. And on top of that, we often will do a combination of platelet-rich plasma, which is derived from your own blood to stimulate the collagen and improve skin quality, addressing some of the facial aging and environmental skin issues. And sometimes we also combine either an energy-based device like a radiofrequency, such as Pelave for a darker skin type, or a laser such as fractional CO2 or erbium laser for lighter skin type. Everything is always customized. On top of that, structural volumizing for the cheekbones can also be beneficial. So I think that it's very important that you meet with qualified, experienced cosmetic surgeons, learn about your options, learn about what makes sense to you. You have to think about what is the outcome that you want and what are the procedures that will get you there. You may want to do everything at once. You may want to take it in small steps. In our practice, my patients have been with me for years, and we actually look at things from a more long view rather than just from a single procedural outcome. We have so many more options these days. We have a lot of ways to solve issues, and we have a lot of strategies that can optimize and be customized to your needs. So I think it's very, very important you just get that flavor by meeting with doctors and seeing what you're comfortable with. Everyone's got their own style, and it's important that that your personal style and the doctor's style really are in synchrony. So I hope that was helpful. I wish you the best of luck, and thank you for your question.